Hi guys, it's Mirka speaking and I am the founder of Beauty by Mirka. So I'm so excited because today is Monday and as I promised you, we are going to be talking the whole week about full individual eyelash extensions. We are going to be talking about the whole training manual from Monday to Friday, but we try to keep our video quite short because I do find when there are only like 10 minutes short videos, people are paying more attention to it. So we're gonna split it into 5 different days. So make sure you subscribe and stay tuned. Let's start with the patch test. Patch test is very, very important. Every single client has to be patch tested for the product you're going to be using on her. With the patch test, you're going to find out if your client is or is not suitable for the treatment. You have to apply a little bit of adhesive you will be using on your client onto microbrush, and you're going to put a little dab behind your client's ear, or you can apply a couple of lashes in the outer corner of your client's eye. If she's got any redness, itchiness or swelling, that means your client is not suitable for the treatment. Now, if your client is going through hormonal changes like pregnancy or menopause, your client has to be patch tested one more time. If you are changing your product, your client has to be patch tested again because she might not have any reaction to your previous product, but she might have reaction to the new product. Now, while you're doing patch test for your client, it's quite handy to explain to your client what is actually going to happen. Because I've had previously one client, when I told her to close her eyes, she kind of panicked and she said that she didn't know her eyes should be closed the whole time and she is claustrophobic. So I was unable to do eyelash extensions for this client. I not only lost my 1.5 hour what I could give to another client, but I also lost the money because I couldn't do the treatment. So when you are doing the patch test for your client, please explain the treatment to her, for her to know what is actually happening. Tell her all the aftercare, what she needs to do, because she might be preparing to go to the gym straight after, go into sauna and steam room. So she needs to know everything all about the treatment. So like this, you know, she's not going to cancel because she wasn't prepared for any of that, but you know that she's happy to go ahead with the treatment. She knows that the eyes will be closed for 1.5 hours. She needs to be laying down for you, and either you're gonna be visiting her or she needs to come to you and you are going to be using the adhesive on her. So I think this is quite handy to tell your client beforehand. Patch test needs to be done at least 48 hours before your client's treatment. Then comes the client consultation form. So the consultation form, it's another big step of what you have to do before every treatment. Now, as you know, here in England, the insurance is really, really important. So this form will actually cover you for the insurance if something does go wrong. You can get this form from any supplier, from eBay, Amazon. You can make your own if you want to. This particular one is from eBay, and what you have to be looking at is basically everything on the form. So when your client finishes the form, you don't just take it from her and put it on the side. You have to always check what she's written. So one of the main things what you're going to be checking would be date of birth. So all depends who you are insured with, but probably most of the insurance will tell you the legal age for eyelash extensions is from 18 up. If the insurance will tell you you can lash someone who is only 16 years old, they will probably tell you to bring the parent consent form together with her, and if she does bring it, then make sure you staple it to her consultation form so everything is kept together. Another thing what you're going to be looking at is the contraindications. So contraindications, with the contraindications, you're going to find out if your client is suitable for the treatment. If she ticks any of the contraindications, you need to communicate, depending what it is. If she ticks eczema, then the communication starts. Where is your eczema? If she points at the leg, then obviously you can go ahead with the treatment. But anything from here up, you cannot do the treatment. Now, we are not doctors, we are not legally here to tell her what she's got on her face, okay, so we cannot diagnose her. All you can say is, I'm really sorry, I cannot go ahead with the treatment. Please, once it's gone, please come back and I'm more than happy to go ahead with the treatment. Guys, it's not worth the money, it's not worth the reputation. So definitely, if anything what you see from here up, okay, you cannot do the treatment. Now, another thing what you need to be aware of is the contact lenses, and I see many people are actually doing eyelash extensions when their client has got contact lenses in, and they're thinking, well, nothing's gonna happen because her eyes are closed. Now, this is one of the good case, but just imagine that she does fall asleep and she opens up her eyes unknowingly because she just like wakes up really quickly. Those fumes from the glue can actually go under the contact lens, and that can cause infection. So contact lenses are a big no-no for the eyelash extensions. I said it to every student, contact lenses has to be removed before you do individual eyelash extensions, and they cannot be put in for another 24 hours, okay? Now, any known allergies, then if she ticks yes, you need to communicate with her to find out what kind of allergies has she got, and then you decide if you can go ahead with the treatment. If she takes pregnancy, it's depending what your insurance will tell you. Some of the insurance may say no, you cannot do pregnant ladies, but some of the insurance might say yes. And if you do pregnant ladies, please make sure that she is over first trimester, which is 3 months pregnant. So she is past first trimester and she is not longer pregnant than I would say probably 7-8 months, because just imagine if you are actually doing eyelash extensions, she would be probably laying quite flat. So if you do have a bed but it lifts up a little bit, make sure that you put her more into sitting position, okay, so she's more comfortable on her back. And now if she's more in a sitting position, also you need to be thinking that her eyes will be closed for 1.5 hours. This is really long time for someone who is pregnant more than 7-8 months, because they need to go more often to the toilet. Now they can't do that because their eyes are closed, so I do not lash anyone past around 7-8 months pregnancy. Yeah, so you just think about stuff like that as well. Now another thing is, when someone is pregnant, the eyelash extensions may not last them as long as they would normally do because of the all hormones, okay? So you need to make sure that your client knows about it, that the extensions will not last as long. Now in this consultation form, there is a question about the patch test. So if the patch test was not done and she's going to tick no, because obviously she's not gonna lie, this can go against you. So please make sure the patch test is done, because this will cover you in the future if something does happen. Now if you turn it to the other side, there is normally, it says date, technician and the lash selection. So our booking system is in the computer, so it's very easy to find the client's name because we just type in her surname and we can see it straight away. But if they do ask you, oh, how long have I had my lashes on already, then it's for you, it's easier to just look quickly through your form and look at the date when she was with you last time, instead of you flicking through your diary to look for her name when was she with you last time. So I always tell my students to write a date each time they come to you, okay? Another thing is the lash selection. So the lashes are separated by length, curl and thickness, the individual lashes. Now I write all the curl thickness and length what I'm using on my client, because they normally say to me, can you do the same what you've done last time, or can we go slightly longer than last time? And there is no way people can remember what was used like 3 weeks ago, 6 months ago, because some of the clients might have lashes done for a certain occasion, for example for a wedding, and then again they might not come back until 6 months later, and they might say, oh, can I have the lashes done exactly the same way what you've done before? So what I normally write would be, for example, C for a curl I've used on her. Then I would write 0.12, like 0.12 for example with the thickness, or 0.15 with the thickness, and then I would write all the length I used on her. So it could be, from example, from 6 millimeter in the length all the way up to 12 millimeter. So whatever I write in here, I make sure I understand my own writing, because I'm the one who actually gonna be seeing this form. I'm the only one who would be seeing this form. So if she does say I want the same, I want to make sure that I'm understanding what I've written for myself, all the details in this card. Then you've got a little comment. If the client tells you something, I don't know, you can just write in the comment and charge and the sign. So this is the client consultation form, and this needs to be stored for 7 years. If you don't have it in a computer, if you've got it in a cabinet, just make sure it's a lockable cabinet, and we do not talk about our client. Everything is private and confidential. Whatever she tells you, you do not say to another people. We do not speak about them, and you will be not only their beauty therapist, but you will be their therapist as well. So I always say to my students, like, you're probably gonna know earlier that she's getting divorced before her husband is knows that he's getting divorced. So please do not speak about your clients. She trusts you, so do not make her disappointed. Okay, so keep them stored away for 7 years in a lockable cabinet, and yeah, that's how you keep them. Now, if you are in any doubt about client suitability for the treatment, if you start questioning yourself, like in your head, like, should I or should I not? This is a red sign, guys. Do not go ahead with the treatment. We do not do the treatment. It's not worth the money, okay? As soon as you start thinking, that means no. Do not do it. If you see something on your client's face and she says, I've always had it there and I had lashes done before with someone else, now instead of you go ahead and do it, all you can say is to ask her to bring a GP consent form, and you can always staple it to her consultation form so everything is kept together. But if you do have the doctor's consent form, at least you know that you are able to go ahead with the treatment.